that was presenting today who could not join us. So I do want to give kudos. These are not my slides, so I think it's important, and I will make a note on that when we send this out to the group, that Kim Gardner, who is our Director of Quality here, these are her slides, and so she was unable to join us today, so I'm happy to step in and talk to you a little bit about sustainability, which is really where we all are right now in this work. So next slide. So when we talk about sustainability within the context of the model of change, right, we've been talking about this now for the past 7 or 8 months. And this is where we're at, right? You folks have been doing this now for 7 or 8 months. This is what you do. This is the work that you do every day. So think about this throughout this didactic, is that what have you done? Again, when we say QI, this is also HPV vaccinations. And the things that you folks have been doing, whether it's new outreach, prompts, making sure they're getting those 6-month appointments, whatever that focus has been, is it sustainable, right? You want this to be something that you do every day. And this is a great quote from Winston Churchill that says, to improve is to change, to be perfect is to change often. And I think this is a great takeaway. I think that, it's important to change, but I think, with quality improvement, once we do something once, doesn't mean that it always has to stay that way, right? We can always make changes and improve it. It's always ongoing. Next slide. So what is an SDA cycle? So you have heard us, again, for the last, multiple months, talk about a PDSA cycle. So you all have this, you all have done this, you've all, most of you have presented on this. And so I think everyone has a really good grasp on developing a PDSA cycle, doing a PDSA cycle, and what that means. So in your mind, this is the next step. So this is called an SDA cycle. And really the idea behind it is to standardize the process that you've just put into place and that you determine that works. So the idea behind it is very simple, it's very powerful. Again, you've been doing these PDSAs until you reach that aim, right? Whatever that was, whether you want to work on your outreach or your prompts or whatever piece of that you were focusing on. And now you want to keep this work that you've been doing and continue this gains by doing things the right way, the right things the right way. So again, this is logical, right? That next step is a standard method, and to continue to use until you determine, you know what, we need to change this again. We need to do something a little bit different. So the important steps in this to remember is, okay, we've done the PDSA cycle. You said, yep, this is great. We're going to continue this outreach. This is what we want to do. We're seeing our rates for 11, 12, and 13-year-olds increase. Now what, right? We want to document this process. So if someone's there who's doing the work is not there, is it written somewhere so that someone else could step in and do it, right? That's really important. We also want to think about, training someone else. So if you're not there and out, that someone else understands how to do this process, okay? That's a critical piece, because I hear that a lot, right? We know sometimes this can be transitions in staff, or staff moves to different positions. So again, having it written down how to do it and what the work that you do means it's going to continue. Again, I just wrote, again, sometimes that's changing people within that. Sometimes there's skills training that's involved. And again, you want to monitor this process, right, to see if it's working. Next slide. So what leads to sustainable change, right? What means that all this work that you're doing is continue? So all of you are here, and you have been involved in this work and joining us every month and sharing all these thoughts and ideas together. So we know that you have this desire and will to make a difference with HPV vaccination with your adolescents. So the motivation for you all to come and do this work is that, again, you're bonding with colleagues and you're all working on the same problem together. You have this desire and will to continue to increase the quality of care with your patients. It's a great place to get ideas, right? When you're talking about sustainable change, again, you get ideas when you're looking at research. Elizabeth, you've mentioned this before. As you look at the research and look at things, you get ideas from one another, from what you read, and then execution, right? You've read it, you want to try it, let's put it into a PDSA cycle, and let's see if we can begin using it, which will lead to sustainability. Next slide. So under sustainability, this is not going to be any shocking new information for all of you, but really important as a reminder to remember that all these things lead truly to this culture of improvement. So this is really big picture. Yes, you're working on HPV, but you want to have a practice that people say, excellent, they like trying new things, right? Let's try this. Let's see if it works. And you don't want to hear, right, well, you know what? Oh my gosh, just another change, something else that we're going to try. There's such a difference in that, right? Being excited about trying new things And that really that all these pieces come together to help create this culture of improvement. Next slide. So leadership matters. We've talked about this before, engaging your staff, and truly we know that leadership is essential to drive these improvements in healthcare quality, in your patient safety that you work on, and really to lead that big picture organizational and system transformation. Our leadership helps prioritize your opportunities. What's the most important thing, right? What is the biggest thing that we need to focus on now? How do we build capacity, make sure that we're keeping our staff, keeping everybody on board and feeling that they're making a difference, and giving everyone the capability and the training to do so. And then modeling a culture of improvement themselves, right? You want a leader that believes in what they're talking about. Next slide. Data and evaluation matter. You've all just proven this in this project, right? So we had baseline data. You share it every day, with your, not every day, I should say, with your staff and your meetings, but you're always looking at data. And how do you know that the changes you're making are leading to improvement? Simple, you measure. And that's what we've been doing, and we just talked about the data together. And again, remember in this work, it doesn't have to be huge. Measurement doesn't have to be difficult or time-consuming. The important thing is to pick the right things to measure so that you can see results quickly and engage your staff and adapt your interventions as you need to. So again, this puts less strain on your resources, on the work that you do every day, and more focus on your outcomes. Next slide, please. Teams matter, right? This is not anything new to all of you, right? Your colleagues, your people you work with every day. I know this as we sit here as a team for all of you. We all bring different things to the table. We all bring strengths and differences and multiple capabilities. And the greater number we have of people working towards the same goal, the more likely we're going to have that success, right? Makes sense. Leading from any chair, again, everybody is part of the team. Every person that touches that patient is part of this work. And encourage team members always, right? You always want to encourage people to give up ideas, share their thoughts, so everybody has that buy-in and engagement into the work that you're doing. Next slide. One thing that I think is important to always remember in this work is our patient and family voices matter. And I know that you all know that, but sometimes I think it's easy, to forget sometimes they're part of actually this quality improvement team. So if we really want to know how we're doing in our work as we're seeing patients, we need to ask them, right? We need to ask them how they're doing, how you're doing, and if they have any thoughts or feedback on that. So, and I really like this. This is my takeaway from this entire slide deck, to be quite honest with you. There's a few things, but this is one of them. And I really liked the way Kim had written, shift the conversation from what's the matter to the patient to what matters to you. And I think this is really impactful, not just in this work with HPV, but anything you're working with the patient, right? We need to know what matters to them as we develop their care plan, right? Their management goals, because then we know that they're going to work to that. It's not about us deciding what they need. It's really deciding, right, what matters to them. So I really liked that a lot. And again, this allows you to work with systems together, right? Your whole team communicating together, compassionately caring for your patients to increase their voice and their influence on our work we do. Next slide. And I touched on this briefly a minute ago, but system change matter. Again, we talked about leadership, we talked about system redesign, everybody being on board, really this culture of quality improvement, right? Because as we redesign, then you're looking at improving the quality of care, the efficiency of your work, and again, the effectiveness in the patients that you serve. And having a business plan around this for sustainability allows you to recruit and retain your staff. Keeping up with the latest, revenue cycles, coding, all those pieces. This is, again, big picture system change matters within quality improvement as well. Next slide. Finally, we can't forget to celebrate, right? So think of the work that you're doing, and truly, when we think of this work, it's focusing on individuals and families. It's population health management. We're looking at cost control all the time. Your system integration and execution. All of you teams, all of you, these practices are working together. And it's really important that when things are successful, that you talk about it, right? Again, we want to change so that people say, okay, what's next, right? This really worked great. Let's do it. What's next? What else can we tweak? What can we change? And then before you know it, and I've seen this happen multiple times in practices, before you know it, without even really feeling it, all of a sudden that culture has changed, and it truly is a culture of positiveness around really improving the quality of care for patients through quality improvement methodologies and changing these interventions and trying new things. And again, asking staff what matters to you. And then in closing, I just want to talk about resiliency. So that's going to be the topic for the last of our sessions together for next month. And it's going to be Teresa and Anna and I all together. Got all three of us for the last one to give our thoughts on resiliency, again, which again focuses, under that umbrella of sustainability as well, right? So stay tuned for our next didactics about this. So again, it's finding that place, right, between a rock and a hard place, right? And where there's a little wiggle room in your time schedule, the process you're doing, whatever you're working on, for that little test of change and that little bit of improvement, which can lead to big things. So again, we all appreciate all the work that you folks have done in this work. And again, the data is showing it. So I hope that you all feel, when you get off the call today, I want you to all feel really good and really that you're making a difference in really preventing cancer, right? I mean, it really doesn't get, any better than that, I think, in multiple ways. So thank you all so much. So any questions for me